It is sunny and bright. Hey guys, welcome back to another vlog here. Last we spoke, I was telling you guys a little bit about my experience with my 20-week ultrasound and the doctor that I had and how I wanted to switch going somewhere else. So very fortunately, I was able to speak to someone right away at another practice that I went to once before, and I explained to them a few different things, and they actually got me in for an appointment the same week. So I went Monday for the 20-week ultrasound, and I spoke to someone the very next day, Tuesday. They booked me for Thursday, which is today. I'm actually just in the parking lot a bit early right now, but I'm going to meet with a new doctor, and I actually researched this doctor and he had all like 5-star reviews, so I'm really happy about that. I don't mind so much, as I mentioned before, if it's a larger practice and I have to be seen by different doctors, but I just really don't like the fact that the doctor and the technician brought up a concerning factor about one of my babies without really going into detail about it, without actually telling me it was something to be concerned about and the reasons why. I felt like this doctor was more focused on trying to sell me to go do a blood test for genetic testing, which not everyone always does. Like, I don't need to do carrier screening, you know. I'm not super concerned about that. And it's a personal choice, I guess. And if you have the extra funds to do things, because it's not all covered by insurance, then, and you want to do it, then you should do it. But I felt like there was a bigger issue at hand, which I didn't even realize how serious this condition is. And the fact that the technician was saying that she wasn't 100% sure if it was accurate because of the movement of my baby making it hard to take photos that day. She, a bit difficult. But so I feel like that was a topic to focus more on, and I didn't feel like there was any explanation. There wasn't anything about it. So I'm hoping to get some clarification today, hoping to just have a better overall experience. This is my first pregnancy, and a lot of stuff is unknown. Like, you just don't know these things until they happen. So with that being said, I have an appointment in like about 30 minutes from now or so. I'm kind of really early. It's actually not for another hour. But I made good timing, and the traffic was not bad, and it was easy to get here. I was praying along the way. I have a little bit of an anxiety today just because I'm nervous. The unknown is always kind of scary, and I'm just hopeful that everything's fine. I'm realizing I don't have a mask with me. I'm going to a doctor's office. I think I have one. Let's check in the purse while we chat, but I think I do. But yeah, I do. Okay, cool. Just a little nervous about if this is really gonna be a thing or not that I have to worry about. Yes, I want to spritz myself to feel a little better. I don't know. I'm just hopeful that everything's fine. I'm hoping that even if it is this situation that I will go into detail at another point in time, that it's something that we just monitor and then don't have to worry about. Like, I'm hoping it doesn't become anything too serious, because there is a few different things that could happen. And honestly, from what I had read today, it's not good. But yeah, so we shall see, and we will remain hopeful, and we're going to keep praying, because that's what I do. Just send some good positive vibes towards my babies. Forget about me, just protect them, right? Just send some good positive vibes my way for my little babies. Yeah, and I guess I will fill you guys in after. I'm gonna go head in there and just kind of like wait, fill out any paperwork that needs to be filled, and I will fill you all in later. Bye. Hey guys, I am back in the car again. At least I'm out of the tree for all my Jurassic Park fans out there. I had a really good appointment. This doctor was so much better. Bedside manner really is important when you're going through some anxiety throughout your pregnancy and, you know, you have a stressful topic to discuss. So I apologize. I don't know how to pronounce the official term for this. Maybe I could write it on the screen. I don't even know if I know how to do that, but if I can, I will. But pretty much the insertion of the cord on one of my babies is a thing that we have to be concerned about, because if it ruptures or something, there'd be hemorrhaging between the baby and me. But overall, he wasn't terribly concerned. He said, yes, there are things that you have to, you know about and this and that, but it's not something to get worried about. It seems like it's more of an issue when it comes time to deliver, during birth, labor. That would be when it's something to be concerned about. Due to this very rare condition, I have a higher chance of being hospitalized starting at 30 weeks. And he says mostly it feels more like an inconvenience for some, because, it's not what they were expecting. So there's just a really big chance that I would be hospitalized, which we wouldn't know until we're like closer to those weeks and checking on the ultrasounds. And if it gets recommended, then, somewhere 30 to 32 weeks, I could end up being in the hospital up until the time of delivery, essentially, which at that point they would probably just opt for a C-section further out when they can, depending on how things are going. So I mean, it's just good things for me to be aware of. Like, I should have a hospital bag packed and ready to go sooner rather than later, because I'm already 20 weeks, and in another 10 to 12 weeks there's again a huge chance that I may just end up being hospitalized for several weeks for close monitoring and all that good stuff, which is not the greatest, but knowing that I'd be safer and that my babies would be safer in this instance, then that's just, if that's what it has to be, that's what it will have to be. Yeah, these things are kind of scary, but I'm just trying to remain as calm as possible. Like I said, I'm suffering with some anxiety today. I'm nervous about this whole thing. And when I left the other place on Monday, all these days I'm left to myself to kind of research and figure out what this means. And then of course I'm having these horrible thoughts of, oh my God, am I going to lose one of my babies? And it's not something that I want to dwell on, but it's something I have to be aware of. But thankfully right now it doesn't seem like I should worry about that. He said I asked him if he's seen this before, because when I researched, it said it was like a 1% in all pregnancies that someone would get this. It's only a 1% chance. He's like, it is more common than you think. He's like, I haven't ever seen it cause a fetal death. So that made me feel, good. But it is something that they're very prepared to take very well care of, which just made me feel really good, because he talked very positively about the practice and the hospital. And even when I was talking to the woman at checkout, it was such night and day from the other place. The only thing I will say is the woman who checked me in was not pleasant, but that was just her. And they were using a new system, so maybe she was struggling, so she gets a pass. And I won't even talk badly about it, just that she could have been a little bit nicer for a first time visit. But again, situational. But everybody else, everything was great, from the nurse and whatnot. So I feel a little bit better, but it also kind of scrunches down my time frame a bit, because now I have to be mentally and physically, emotionally prepared every which way I can be, that there's a chance that I'm going to be hospitalized because of this condition. So I can only take it week by week, visit by visit. I go back in another 4 weeks for my next visit, and then from there I should have 2 appointments by then. One to do another ultrasound, and then one is just for my standard prenatal. The ultrasound will check their growth, and it will also check on the cord. So, it is what it is. And we shall see what happens. Remain positive, have my faith, and just try not to freak out on anything. But yeah, I will chat with you guys another time. Thanks for hanging out with me. If I have not figured out how to write down what is the cord definition, I will just write it in the description of this video to make life a little easier. So, but yeah, I will talk to you guys another time. Bye.